Well, in light of this deadly shooting in Las Vegas, this is yet another instance where it can be difficult to discuss such a sensitive topic with your children. We are joined now by Dr. Laura Saunders from the Institute for Living at Hartford Hospital. And Dr. Saunders, thanks as always for joining us.
Thanks,
and it is a sad reality that this is not the first time we've had this conversation about talking to your kids.
It is not the first time.
So let's drill down a little deeper on things that we've talked about before. And I know one thing you want to talk about is age-appropriate language when you talk to your kids. So what do you mean by that exactly?
So I always say we take a developmental approach. Younger kids need simple, fact-based information. Older kids may want to discuss things about motive or reasons why. So with older kids, you can have some of those discussions as best we can answer them. With younger kids, you want to stay more fact-based.
Mm-hmm. And parents are going to have to make that call as to which category the kids fit into, but you just have to be sensitive to what you see your kids going through, right?
Absolutely. I always want to be more careful with kids who have vulnerabilities, might be prone to anxiety, might be prone to depression, have previously experienced a trauma or a significant loss. Those kids I'm going to keep a little closer eye on, and parents and teachers, we know who those kids are. We know that we need to be a little bit more sensitive, that they may react in a certain way to a tragedy like this.
Do you suggest bringing this up or waiting for your kids to ask?
The general guideline I use is to wait for them to ask you questions. It also requires that we don't have news on a 24-hour continuous loop, because otherwise they just become inundated with information that might be confusing to them.
So we really can't shield them from news. As you say, there's the 24-hour loop. If they pass a television set that's on CNN, they're going to see this. How do we make kids feel safe when these kinds of things are going on? And B, at what point is it appropriate to go ahead and help them understand that life does come with some risk?
So the guideline I generally use is to provide assurance, not promises. Assurance is we're going to do our best in our home and in your school to keep you safe. There are administrators and police and firefighters that work hard to keep us safe. It's good to practice fire drills. Schools practice them, we practice them at home. So to do things that lessen anxiety. But there's some degree of bad things that just happen. And that's where we have to remember to take opportunities to reconnect. Tell your kids, tell your grandparents, tell whoever. You care about them, you love them. Sit and have dinner together. Find meaningful moments whenever possible.
That helps them feel secure, and they can deal with things when they do happen.
Absolutely.
All right. Dr. Laura Saunders from the Institute of Living, thanks for joining us today.
Thank you, Brent.
All right. Audrey, back to you.